Saturday alone, we had 5 calls in under 5 hours of time.
Not long ago, the opioid crisis dominated headlines. Fentanyl now has the label as the deadliest drug in America.
Last year, a new crisis took over.
The first case of community spread in Wisconsin.
I have declared a public health emergency.
But opioids don't listen to headlines. Since 2002, the Milwaukee County Medical Examiner's Office tracked a steady climb in narcotic deaths. And since the pandemic, narcotic deaths jumped 34% within the last year. The experts in the Medical Examiner's Office see the toll of this crisis in their building every single day.
Sarah Schreiber is a toxicologist with Milwaukee County Medical Examiner's Office. Sarah, thank you for joining us today. We want to talk about the numbers in terms of opioid overdoses in Milwaukee County. Where has the trend been over the last few years?
The trend within Milwaukee County has been increasing for the last number of years. We saw a small dip in overall deaths in 2018, but since then everything has been going nowhere but up.
And what trends have you noticed since the pandemic disrupted work, the personal connections, and the support systems folks are having?
Reaching out to those kind of institutions was difficult, or those agencies, and therefore making things difficult for somebody who was looking for resources or medications or getting support that they needed, and therefore those things became extra difficult for them.
And I know your office has the difficult job of the front lines of seeing these deaths and determining how a person died, and then having the conversation, notifying families. How tough of a job is that when it comes to this problem that we're having that's become so prevalent in terms of the number of people who are overdosing because of opioids?
I think each case, of course, is different. There are some families that are naive to the fact that their loved one was using at the time that they died. There are some that are well aware of it and realize like this is the end, and maybe one that we have been expecting for some time, and unfortunately it happened now. And there are other folks that are just, really kind of paralyzed by the information, and they don't know how to process it, what to do with it on top of everything else that is going on. So there's quite a wide array. And we've got an office that can be really proud of the medical investigators that we have that do that kind of correspondence with the families on a daily basis. They do a very good job.
And last question, how problematic has the addition of fentanyl been in this epidemic?
Fentanyl has been a big portion of the casework that we've seen. Greater than 75% of the cases that involve a narcotic involve some form of fentanyl. The vast majority are fentanyl itself, but there is a good number of cases that deal with an analog, and we've had some new ones appear in the last couple of years that just make things that much more difficult. It's difficult analytically to keep on top of those trends and to make sure that we're always searching for the right compounds, but it's got to be even more difficult for the user on the other end of this to understand what it is that they're really purchasing and to be able to consider using that product in a safe manner.
It wasn't, I'm going to kill myself. It was, I realized I'm killing myself.
Addiction may not have taken his life, but it did take nearly everything else from the Milwaukee Bucks coach. Vin Baker's story and how he's helping others.
Plus, more than half of all addicts find their first opioid at home. What you can do to reduce the chances of it happening in yours.
This is what every family needs to know.